And could you explain a little bit more the closed loop paradigms that you're using? So for a general audience, what's the concept there? What's the idea?
So when we say closed loop, we mean that we have some sort of feedback about how the patient responded to the therapy, such that based on what their response is, we can adjust and tailor the therapy to their needs. So in an open loop approach, you would just give a therapy, whether it's deep brain stimulation or a drug, you would just give it in regular doses. You don't adjust it over time. But when you close the loop, you actually look at, okay, how did the brain respond to this therapy? How is the symptom changing in response to this therapy? So that's what we mean by closing the loop, getting that feedback. Now, in our case, we get it in the form of brain activity and then decoding their symptom state. And then based on how the symptom state is changing over time in response to therapy, we then adjust it over time. So that's what we mean by closing the loop. It's kind of a feedback control system coming from the engineering concepts. That's how we control airplanes with autopilots, for example, or thermostats or all of that. But we're bringing some of those concepts and principles to bear in coming up with more effective therapies for patients.